Hello and welcome to the Smart Connections podcast and the Talk the Path podcast. My name is Anna Sanderlin. I am a warm-line facilitator for the University of Memphis Smart Center. The University of Memphis School of Social Work Smart Research, Training, and Treatment Center aims to provide evidence-based interventions for school-based mental health programming, increase access for school-based behavioral health programming in underserved areas, offer training on best practices in telebehavioral health, develop opportunities to research the use of technology in practice, and provide direct services to the state's most vulnerable populations. You can call the Smart Center at 901-678-1636. The University of Memphis Smart Center, in conjunction with the University of Tennessee, Knoxville, and the Tennessee Department of Mental Health and Substance Abuse Services, would like to present the Pathways to Behavioral Health Careers Project. The goals of the Pathways Project are to provide education and information on the various career opportunities in the field of behavioral health through presentations, increase interest in students in the field of behavioral health, provide opportunities for guidance with information regarding college, university programming that result in degrees for professions in the field of behavioral health, connect students with students in behavioral health programs and professionals in the field for further research. This podcast will feature students and professionals in the field to give a clear picture of the daily duties of these roles and how they help support their communities.
I'm Ahmanni with the School-Based Behavioral Health Liaison program. I'm the Technical Assistance Coordinator for Region 2.
Awesome. Thank you so much for introducing yourself. So first, I wanted to just jump in and ask you if you could just tell us a little bit about what a Technical Assistance Coordinator does in supporting behavioral health.
Yeah, so for sure we're called TAs, but technical assistance coordinators, we do a lot as far as like supporting behavioral health. The behavioral health liaisons, who are the therapists that are in the schools working with the consumers on a day-to-day basis, we provide that background support for them. So we do a lot of program development. We do a lot of training for the liaisons. We provide resources for the behavioral health liaisons. We also provide feedback to the Department of Mental Health and Substance Abuse Services about the program to help kind of shape and mold the program from the lens of what the liaison is experiencing on a day-to-day. We're kind of that middle person between like the program, the liaison, the mental health organization that the liaison is assigned to, and the state. So we're kind of the glue in a way that keeps all the communication happening between all different moving parts.
Oh, wow. You know, that is something that I have heard throughout my career about gaps in the service continuum and how they affect, you know, not only outcomes, but service delivery, access. So it is awesome to hear that there are positions being created to finally fill those gaps. And as you said, strengthen the linkages and, you know, kind of vet all of the resources that are available. Because let's be honest, all resources are not created equal. And we have different fits that may go better with different needs. So to know that you've got a position that can, you know, view all of those and get a better match than without you being here sounds amazing. And sounds really rewarding as well, because you get to see the product of your work across the service continuum. So thank you so much for sharing just that really thorough description. And I'm hopeful that the project has, you know, expansion in its sites and, you know, more technical assistance individuals will be on the ready, you know, across the nation. Can you tell me a little bit about your journey to start working as a technical assistance coordinator for the community?
Yeah. So I really feel like the background that I have has really helped me to be a better TA, because prior to this, I was a clinician myself. So I was a school-based therapist, providing those services to consumers ages kindergarten all the way up through the 8th grade. So I guess you could say Primarily, I was a clinician, and then I made that jump to be on the administrative side of things. So I feel like I have
Mhm.
that insight to really understand what it's like on a day to day being at the school. And, because when you work in a school, it's a lot different than when you are providing therapy in an office because you have to think about the parents, you have to think about their school schedule. You can't pull kids during certain blocks of the day because maybe they're in
Mhm.
math. You also have to coordinate with like school staff, get to know your principal. So I am aware of like all the dynamics of like school-based mental health. So that pretty much led me to where I am now, working on the other side of things, not necessarily doing that groundwork being a clinician, but more on the administrative side.
Mhm. Mhm. I absolutely can see how, having to navigate so many different parts of the school system could be difficult to manage. But with you coming from the clinical side, having to do your own management of your practice and having some experience with scheduling and listening and drawing out
Mhm.
what's important, what's useful in that role and presenting it in a way that's most helpful for the individual who's serving definitely probably helped prepared you in the most unique
Yeah.
way for the TA position. Did
Mhm.
you experience like any difficulty in your journey getting in just for students who may, be unsure of how to get to a position like this? Are there any things that they should be mindful of or watch for, or an experience you had that, a lesson learned could be utilized by those who listen to the podcast?
Yeah, so I love this question. So I would say the two biggest skills that helped me to not come across many difficulties in my role was being really skilled at de-escalation
Mm.
because adults have emotions just like children, and
Uh-huh.
being in my role and in my position, I deal with lots of adults, lots of organizations, lots of different interests, lots of different personalities. So just having that skill of knowing how to validate a person, keep them calm, figure out what's the problem, provide a solution. Those are all de-escalation strategies that I've taken from a clinician and I've implemented it in my role as a TA. And then
Mhm.
also having tact. Tact
Mm.
is so important. How you speak to people, how you present things, how you receive things, how you can get someone to buy into a process or see the benefit from a certain service being provided. Like tact is so important when you are working with like community partners, when you're working with principals, when you're working with families. You have to be very tactful. So,
Mm.
for someone looking to be in a more administrative role or to be in a position where they are having contact with a lot of different people, you have to have a lot of tact because you don't want to, rub someone the wrong way
Mhm.
or anything like that. So, I think that's so important.
Mhm. Wow, uh, those are two things that I wish we were all born with because we literally would be living in a world where we wake up with flowers blooming, everyone happy, everyone getting their need met, and we just hear wonderful music every morning because those are two culprits that create these tense, terse situations where we have, unfortunate outcomes. So, thank you so
Hmm.
much for mentioning that, especially de-escalation, because it is a skill that I have always believed teaching de-escalation, practices should be used across all jobs because as you
Hmm.
so rightfully said, emotions are held by children and adults and everyone can't carry their emotions and their responses in the same way and aren't always responsible with how they exact out feelings of discomfort or anger or sadness, and through no fault of their own. So, to be paired with a person that's skilled in de-escalating situations, they get to not only benefit from that, but see how it's done. So it's wonderful to know that that's something that you excel in, and that the individuals that you serve, get to have lots of access to. And oh my goodness, the tact. I've seen so many situations, as the young folks say, go up because somebody didn't utilize tact. The way in which you say something, the way in which you approach something can dictate its, trajectory in so many ways. Are we going to spiral out of control here? Or are you going to open up a feeling in me that's going to allow acceptance of what you're saying genuinely? Are you going to make me feel affirmed in a way where I can now share out without fear of judgment? So those two truly do go hand in hand and can create and curate, really good relationships, really good pathways to care, because that expectation will start to be there. Like, I know that this person is not going to make things worse. They're going to help me see it more clearly, gain perspective. So I love hearing those two things. And like I said, I truly am an advocate of, let's teach everybody about de-escalation, because even if you don't become highly skilled at it, you can develop an appreciation for it, right? You can acknowledge its importance in communication cycles and things like that. So both of those just have a place within each individual. So I hope that, there's a big movement for it one day. Can you talk to me about just maybe one or two of your overall goals for being a TA coordinator in your community?
Yes, so I have big dreams, big goals. My goal is to really see the school-based behavioral health liaison program expand to every school in every county in the state of Tennessee. And I really would like for Tennessee to be a front runner and to be a model state for the rest of America, to see how school-based mental health should be ran and how it could be ran, and the benefits of it being ran the way that we plan to implement it here in the great state of Tennessee.
Those are some lofty goals, but I mean, we've got some high level need, of course, here in Tennessee where we reside, but across the nation. So, like I said, when we find, programs, when we find, positions, when we find new ideas that, are valuable, that have the impact that we hope, absolutely, an expansion and replication in environments that have high level need should be priority. And, the way in which we, communicate to those who make the decisions, whether it be for funding them, whether it's for, gaining public, approval and trust in the process, it is a big dream and it is a lofty goal. And it'll take, many to help push it forward. But it's wonderful to hear that someone who is, as you said earlier, the glue, already understanding that it's truly half the battle, because you have this, particular insight from your day-to-day interactions and operating within this program, a very valuable voice that can add to, advocacy for the expansion. So, I'm with you on place one, each one teach one, place one everywhere that's possible. I love to hear that you're thinking along in those ways, because it's really easy to kind of keep your head down and just do your job and not worry about things on that level. But to know that you and other like-minded people like you are working in these positions and still maintaining, hope and pushing for, replication and expansion of these positions, it's good to know. And as students who may come in and want to take part in this role, they see things like this, they see resources connected to it like this, and they know like this is also part of either the job that I want to do or part of my hard work that I want to be a part of. So love that you mentioned
Yeah.
that we're putting that out there in the world for others to join in the fight,
Yeah,
pick up the batons and
I
join the
do
relay.
think I do think that all it takes is for other states to see that it worked and that it was beneficial.
Mhm.
Because a healthy student is a productive student, is, a student with better grades, better academic standing. So I feel like all it
Mm.
takes is for other states to see that, okay, Tennessee made school-based mental health a priority. And because of that, now across the state, their students are excelling in academics and performing better.
Mhm.
So I think it's possible, but like you said, it's going to take a team
Mhm.
effort. But yeah, thanks for
Yeah.
asking that.
Data definitely will drive it, and as people see the changes, you help them believe and you help them become part of, the championing of it. And, I've seen similar, processes and similar things that people have had to fight for. So I absolutely believe it can be done. My next question for you is, what is your kind of biggest challenge you faced in your role, and are there any lessons you can share with us today?
Yeah, so to be honest, I don't really have the mindset of identifying things as challenges. They're more so like opportunities.
Ah,
But
okay.
yeah, but honestly, I'd say the biggest opportunity to really use my skills would be just dealing with lots of different organizations, different schools. Everyone has,
Mm,
their own interests, their own
right.
priorities, and then also collaborating with the state. So I
Mm,
just think that the biggest opportunity there is to provide a plan that serves all of it. Because
mm,
the organization, their priority may be this, and then the school, maybe their
right.
needs are this, and then the state, maybe they want to see this happen. So me being in the middle of all that gives me an opportunity to make sure that everyone is getting their needs met, everyone is happy with the plan, and really kind of just being creative about the approach so that everyone involved is satisfied, and
Right.
which I
Right.
love doing. Like I
Mhm.
love the opportunity to be able to solve problems and really get in there and build those relationships and get everyone like on board. But honestly, I really think that when it comes to the school, the organization, and the leadership for the Department of Mental Health and Substance Abuse Services, at the end of the day, all of their concern is the health of the kids. So that kind of ties everything together and helps it makes it easier for me to be able to do my job, because if the bottom line is that the kids are being helped, then everyone is like on board.
Right. Thank you so much for sharing that about having to be able to use a opportunity to collaborate and promote and
Yeah.
highlight everyone's kind of priority area for what they want to focus on and what they want to see movement on. I think it's very important to note that no matter what job you're in, you are definitely going to have an integrative approach to working with people, because as
Yeah.
so astutely stated, everybody has a different thing that's important to them, and you have to find a way to elevate everybody's interest in a way that where they feel heard, where they feel like
Mhm.
they've been prioritized, and that they're not being, kind of swept off to the side. So I love to hear that you utilize, those types of approaches and seeing success and know they can be done, because a lot of times people see that as a difficult thing to do, or they simply
Mhm.
want to do what's important to them. So knowing that,
Mhm.
you and other individuals who are in your position are able to do that multifaceted approach with everyone's goals, everybody's wants, and see this
Mhm.
level of success is really, really great to know. And it's good to know going in that that is something, you need to either try to work on enhancing your skills around, or, see if that's a good fit for you, or knowing that it's part of the process so that, you won't kind of be surprised. So Thank you so much for sharing that. That's really, really helpful to know, and especially the reframing of it, challenge versus opportunity. I just love that. I'm going to use it from now on. I'll credit you most of the time, okay?
Okay.
The last question I have for you is, how do you continue to learn and stay on top of things in your role? You know, things are always changing in the world, changing with the clients that we serve, changing with the individuals who are in our lives. How do you manage to kind of stay on top of, you know, what works best, or, you know, if new things are coming up, should I, you know, use that in my practice, in my role? How do you stay on top of the, you know, your learning opportunities?
Yeah, so I would say collaboration and being a forever student, I think is really important. Having a mindset all the time that you never know everything. So seeking out for information, going to those conferences, attending those trainings, collaborating with other people in your role who are doing similar work, even, you know, being a student of a different state, like maybe, you know, South Carolina might be doing it differently and maybe it's working for them. So let's see what's their approach. What are their curriculum and how do they go about school-based mental health? So I think it's just always having a humble approach and just knowing that you don't know everything and to really seek out that information. I think that helps me to stay on top of my role. And then also, I think keeping in touch with the people who are on the ground working with the consumers on a day-to-day, because they are going to be your biggest asset as far as understanding what the community really needs. So as long as you're in touch with what the community needs, then you can look out and see how to provide that in whatever way works best. So I think it's like a 3-tiered approach to staying on top of my role.
Hey, oh, I love how you laid that out, collaborating, using resources, especially the using resources, because that's why we're doing what we're doing now. We're creating all of these pockets of information in different ways that can be consumed by students, because we're all different types of learners, so that they can, you know, learn, you know, what's available, what's out there, how do I gain entryway, what should I watch for, what's the best fit for me, how can I change my journey to something that's going to be most rewarding, most impactful. So I just absolutely love how you laid that out, because you are so right. You know, being a forever student, there's always information that's available that you can consume to help you, you know, figure out, you know, next steps or best steps, and then collaborate with other individuals at different levels. So you're right, it's a multi-tiered approach to ensuring, you know, you are still on the cutting edge, so to speak. So thank you so much for sharing that. You have just been a huge boom of information today with tips and kind of laying things out. So I really appreciate you sharing out so much today. Did you have any last comments or advice before we end our recording today?
Yeah, I just say for anyone interested in, you know, being on the administrative side of mental health, just make sure that you're well-rounded, that you understand the big picture, and that you're also keeping your feet on the ground. I think that is a for sure way to be successful. But thank you so much for this opportunity. This was so fun.
Yeah, you are welcome. We really appreciate it. I know, you know, you're probably very busy, so thank you so much for taking your time out with us today. And we absolutely hope to see you again soon.
Thank you so much for tuning in to listen to our podcast, brought to you by the Smart Connections podcast from the Smart Center at the University of Memphis, as well as the Pathways to Behavioral Health Careers Project. If you or anyone you know needs any information from the Smart Center, please contact us at 901-678-1636 or email us at smartcenter@memphis.edu. You can also learn more about us at our website, memphis.edu/smartcenter.